Hey guys, welcome back to All on Law. This is a quick orthopedics, and today I'm going to talk about the vessels injured and the trauma. So I'm going to give you the artery or vessel, okay, that is injured, and you have to tell me the type of trauma that might have occurred, okay. Let's start with a very easy and very simple, that's femoral artery. Femoral, okay. So what type of trauma might have taken place? There's a fracture of lower third of femur, remember, okay. If there's a fracture of the lower third of the femur, then there is a possibility of injury of femoral vessel, and that can lead to severe bleeding, hypovolemia, hypovolemic shock, okay. Now let's talk about if there's a bleeding of what you call a bleeding from injury to brachial artery. What type of fracture might have taken place? It's supracondylar fracture of humerus. Remember, supracondylar fracture of humerus, okay. Right, now let me ask you another question. Okay, subclavian. If the subclavian vessels are involved, what type of fracture has taken place? It's a fracture of clavicle, guys, clavicle, okay. Right. If popliteal is injured, what type of trauma has taken place? Which bone has been injured? Of course it should be femur. And what type of fracture? That's a supracondylar fracture of femur. Remember, if the supracondylar fracture of the humerus takes place, brachial artery is injured. If supracondylar fracture of femur takes place, then popliteal artery is injured, okay. Both arteries are really very important. Posterior tibial artery. So what type of trauma has taken place? It's a dislocation of the knee and the fractured tibia. Knee dislocation, okay, and a fracture of tibia. Remember, right? If axillary vessels are injured, then there is a fracture dislocation of the shoulder. Okay guys, so this is about the brief discussion about the vessels that are injured due to the particular trauma of the bone. Okay guys, so thank you so much for watching this video. Take care.